Welcome to the Omni Dental Podcast. We're taking a deep dive today into something really crucial for keeping your smile healthy. We're talking about how to avoid those unexpected and, well, often painful dental emergencies. All this info comes from the experts at Omni Dental right here in Arlington Heights, Illinois. Our goal, pretty straightforward, give you practical knowledge to protect your teeth and gums and hopefully sidestep those urgent dental visits. You know, it's kind of surprising how many emergencies actually trace back to, well, just our everyday habits.
That's absolutely right. A dental emergency, it can feel like it just pops up out of nowhere, right? But when we really look at what's happening, maybe sudden pain or a chipped tooth, there's often something underlying going on. Take tooth decay, for example. It's not just sugar. It's more like a whole chain reaction that weakens your tooth enamel. Or gum disease, that's a progressive thing, affecting the very foundation holding your teeth in place. Even, say, a cracked tooth might have a history behind it, maybe from stress on the tooth you didn't even realize was happening.
Okay, yeah, let's get into that nitty-gritty. Tooth decay, we hear about sugar, sure. But how exactly does that path lead to a potential emergency?
Right. So when you eat or drink things high in sugar or acid, the bacteria that naturally live in your mouth have a feast. As they break down those sugars, they produce acids. And those acids are the real problem. They actually pull minerals out of your enamel, that hard outer layer. That process is called demineralization. If that keeps happening, over time, tiny holes start to form. That's the beginning of a cavity. Now, if you don't catch it there, the decay can go deeper, right into the tooth's pulp where the nerves are. That's when you get intense pain, maybe infection, possibly an abscess. And that is definitely a dental emergency.
Okay. And gum disease, you mentioned it's more than just occasional bleeding gums. What's the deeper issue there?
Yeah, exactly. Gum disease, or periodontal disease, as dentists call it, is basically a chronic inflammation. It usually kicks off with plaque buildup, that sticky bacterial film always forming on teeth. If you don't brush and floss that plaque away effectively, it can harden into tartar, or calculus. Tartar is much rougher, gives bacteria even more places to hide and thrive. The bacteria in plaque and tartar release toxins that irritate your gums, making them red, swollen, maybe bleed. That's gingivitis, the early stage. But if that inflammation continues, it starts damaging the ligaments and bone that support your teeth. Your gums might pull back, pockets can form between teeth and gums, trapping more bacteria. Eventually, you can lose bone. And if the support weakens enough, teeth get loose, maybe even need to be removed. That's a serious situation.
Yeah. Wow, okay. And cracked teeth. I think most of us have bitten down on something hard by mistake. How does that become an emergency? What's the science there?
Well, tooth enamel is incredibly strong, but it's not indestructible. If you regularly bite down hard on things like ice, popcorn kernels, pens, even fingernails, you put a lot of stress on your teeth. This can create tiny microscopic cracks in the enamel. You might not even feel them at first. But with repeated stress, those little cracks can get bigger, go deeper. Eventually, a piece of the tooth might chip off, or the crack could become significant. If a crack goes deep enough to expose the inner tooth layers, you'll feel sharp pain, especially with chewing or temperature changes. Plus, that crack is like an open door for bacteria, potentially leading to infection inside the tooth. That needs urgent care.
Right. Makes sense. And you mentioned sports earlier, those mouth guards. Why is getting a custom-funded one so much better than just grabbing one from the store?
That's a really good question. Think about it like this. A custom mouthguard is made from an exact mold of your teeth. That means it fits perfectly, stays put, and distributes any impact force evenly across all your teeth and gums. Those boil and bite ones you find in stores, they're better than nothing for sure, but the fit is just, well, it's generic. It might shift around on impact, leaving certain teeth more exposed. Custom guards are also usually made from higher quality, often thicker material, giving you better shock absorption. So it seriously cuts down the risk of breaking, chipping, or, knocking out a tooth during sports. It's just much better protection.
Okay, so we know the common culprits. Let's switch gears to defense. Daily brushing and flossing beyond just doing it, what's happening at like a microscopic level that prevents these emergencies?
The absolute key is disrupting and removing that film of bacteria, the plaque. Brushing, especially with a soft brush and good technique, physically sweeps away a lot of that plaque from the tooth surfaces you can reach. Then the fluoride in your toothpaste gets to work chemically. Remember how acids pull minerals out of enamel? That's demineralization. Fluoride actually helps put those minerals back in. It promotes remineralization, strengthening the enamel and making it more resistant to future acid attacks. It helps repair really early damage.
And flossing feels so basic. But why is it so vital for stopping bigger problems?
Well, think about where your toothbrush can actually reach. It just can't get effectively into those tight spaces between your teeth or right under the gum line. And those are prime real estate for plaque and tiny food bits to hide. Flossing physically scrapes the plaque out of those hard-to-reach areas. Doing that every day stops plaque from building up there, which prevents not only cavities between teeth, but also the gum irritation that starts the whole gum disease process we talked about. You're basically stopping problems in the spots they often sneak up on you.
Okay, daily habits covered. But regular dental checkups are also crucial. What are dentists actually looking for during those visits that we might miss, and how does that prevent emergencies later on?
During a checkup, we're actively hunting for those really subtle early warning signs you probably wouldn't notice yourself. We can spot the very beginning stages of decay, sometimes even before it's a visible hole, and maybe use a fluoride treatment to help reverse it. We check your gums really carefully for any sign of inflammation, bleeding, or recession, the first clues of gum disease. And dental x-rays. They're incredibly important. They let us see under the surface. We can find decay hiding between teeth, check bone levels around your teeth for gum disease damage, spot impacted teeth, cysts, things that could cause major issues down the road if left alone.
So it's about early detection.
Exactly. Catching things small prevents them from becoming big, painful, expensive emergencies. Plus, the professional cleaning removes that hardened tartar you just can't get off with your brush or floss, which is critical for preventing gum disease.
Right, that deeper clean and early catch. Makes sense. What about food? How does eating healthy help build a smile that's less likely to face an emergency?
Your diet really provides the raw materials for strong teeth and healthy gums. Eating balanced meals with lean proteins, fruits, vegetables, and dairy gives you essential nutrients. Think calcium and phosphorus, vital for keeping that enamel strong. Foods like milk, cheese, yogurt are packed with calcium, helping maintain that mineral density in your teeth.
Okay.
And on the flip side, like we talked about with decay, constantly eating sugary or acidic foods just keeps bathing your teeth in those enamel-eroding substances, feeding the bad bacteria. Oh, and drinking plenty of water is great too. It helps rinse away food bits and acids naturally.
We've hit hygiene, checkups, diet. What about those little habits, the ones we might not even realize are putting our teeth at risk?
Ah, yes, those. They can definitely add up. We already mentioned chewing hard stuff like ice or popcorn kernels, big risk for cracks. Another one is using your teeth as tools, opening packages, tearing tape, holding pins.
Oh yeah, I've done that.
Right. It puts weird, uneven forces on teeth, making them way more likely to chip or crack. And for people who grind their teeth, often unconsciously during sleep, that constant pressure wears down enamel, can cause jaw pain, and yeah, definitely lead to fractures over time.
That's where a night guard comes in.
Exactly. A custom night guard acts like a protective cushion. Even things like snacking constantly on sugary stuff throughout the day means your teeth are under acid attack for longer periods, bumping up that decay risk.
This is all really, really helpful. For listeners in the Arlington Heights area or nearby, could you tell us a bit more about Omni Dental? How do you folks help people keep their smiles healthy and handle things when emergencies do pop up?
Sure. So Omni Dental is a family dental practice right here in Arlington Heights, Illinois. Our main focus is providing really comprehensive dental care. That means helping you prevent problems in the first place, but also being ready to take care of any immediate needs you might have. Dr. Billis Poles, he's our principal dentist, has a ton of experience in general, cosmetic, and preventive dentistry. And yes, that absolutely includes handling dental injuries and emergencies effectively. We understand that a dental emergency is stressful, no doubt. Our aim is always to provide prompt, effective, and honestly compassionate care when you need it most.
So you cover everything from the routine stuff to those, unexpected moments.
Absolutely. We offer the full range, regular cleanings, exams, preventive things like fluoride, sealants, but also cosmetic work if you're interested in that, and more advanced treatments like dental implants, root canals if needed. We use modern dental technology in our clinic, which helps with accurate diagnosis and effective treatment. And it's really about a patient-centered approach. We take time to listen, understand your specific needs, your concerns. We're really proud to serve families and individuals all ages here in Arlington Heights and all the nearby communities too. Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, Elk Grove Village. We see folks from all around. You can find us at 305E Rand Road in Arlington Heights, IL 6000. And the phone number is 847-483-8833.
Perfect. And one last thing, even with the best prevention, if an emergency does strike, what are the top one or two things someone should do right away?
Okay, yeah, quick action can make a huge difference. If a tooth gets completely knocked out, first, try to handle it only by the crown, the part you chew with. Gently rinse off any dirt. Don't scrub it. If you can, try to put it back into the socket it came from. Hold it there gently. If you can't get it back in, keep it moist. Put it in a small container of milk or even tucked inside your cheek if possible. Then get to a dentist immediately. Time is absolutely critical for saving a knocked out tooth.
Okay, knocked out tooth, milk, dentist, fast. What about a cracked tooth?
For a cracked or broken tooth, first rinse your mouth gently with warm water. You can put a cold compress on your face over the area to help with swelling. Definitely avoid chewing on that side and call your dentist to be seen as soon as you can. Same for a really bad toothache or signs of infection like facial swelling. Don't wait.
Got it. So, looking at the big picture, avoiding dental emergencies isn't really about luck, is it? It seems like it's much more about understanding why these things happen and then being consistent. Good daily hygiene, regular dental visits, smart food choices, and just being mindful of habits that could damage your teeth.
That sums it up perfectly. Taking those proactive steps isn't just about dodging emergencies. It's really an investment in having a healthy, confident smile for your whole life.
And with that, here's a final thought for you listening. Please don't wait until something hurts or feels wrong. Proactive care really is the key to long-term oral health. So maybe think about it. What's one small change, one simple step you could start today that can make a big difference for your smile down the road?
And again, if you're in the Arlington Heights area or the surrounding communities and you're looking for a dental team that's really committed to your health, we at Omni Dental, led by Dr. Billis Poles, are absolutely here for you. Whether it's time for a routine checkup or if you do run into a dental concern, please give us a call. You can also check out our website for more tips and information. We'd love to help you achieve and keep a healthy smile for many years to come.